We're just giving folks a few minutes to get logged in. If you do have any initial questions, feel free to use the Q&A box for any of those opening questions that would be addressed at the end of the session. I still see some folks coming in, so we'll give it another minute or so. Thanks to those who are here already. We look forward to a good conversation today. We're just giving folks a few more moments to get logged in. Thank you all for joining us. We'll get started momentarily. Thank you all for joining us today. I will now turn it over to ASH Executive Director, Laurent Hubert.
Thank you, Megan. And so I want to welcome everyone and thank you for joining us today for this webinar on the topic of Endgame and how do we engage the whole of society in support of Endgame policies, tobacco Endgame policies. It's well established already that tobacco not only harms our health, but also harms our environment, our economies, and has been recognized as an obstacle to various human rights that have been recognized at the highest level of international law through human rights treaties. So clearly this ending the tobacco epidemic cannot be siloed into departments of health, but really requires a whole of society approach, a holistic approach, and support from the whole of society, governments, not-for-profits, for-profits, the corporate world, etc., at the local, national, and international level. So this discussion today, the presentations today and the webinar today will focus on that topic, which is also something that emerged during the various tobacco endgame summits that ASH hosted in 2025 last year. We collected a lot of data from the participants, and there was clearly a demand and a need for increased cooperation and collaboration among various sectors to accelerate progress towards endgame. That was one of the things that was identified by those who participated in those summits. And those summits were joined by civil society, governments, as well as some private sector partners and funders. So clearly there was this demand to engage all of society in addressing endgame. But unfortunately, when it comes to the tobacco epidemic and to addressing the tobacco epidemic, one of the key obstacles that we keep on facing is actually a lack of whole of government engagement. So it's something that we hope we can address this webinar today by bringing a combination of civil society, private sector, and intergovernmental players who will present examples of some constructive ways and collaborative approaches to achieve an endgame vision. And also to clarify the definition in this case of endgame, it can differ from group to group. But here what we're talking about is phasing out the sale, phasing out the sale of commercial recreational nicotine products. So how far can we go in reducing the supply of those recreational nicotine products and stopping the industry from flooding the market with addictive and harmful products? So without any further ado, we'll get started with the three panelists that we have from intergovernmental agency, the FCTC, a government representative who's led the Endgame task force not only in her country, in Finland, but within the European Union and the European Commission work, as well as a corporate actor who's made a recreational nicotine-free future commitment. So fully aligning with that nicotine endgame, nicotine-free future endgame. And as civil society, we've been very, very involved in in tobacco control in general and endgame. And we could argue almost to some extent that civil society was very involved in promoting and advocating for more and more measures to further protect health and implement more policies and novel policies in order to further address the supply side of tobacco products and protect our populations from nicotine addiction. So we will hear now from the three panelists. The first panelist is Dr. Tibor Slizagi, who's the team lead on reporting and knowledge management for the WHO FCTC Secretariat, so that the UN treaty to address tobacco. And he will address how an international treaty with a global reach like the FCTC can provide an unparalleled intergovernmental platform for advancing tobacco endgame, something we've seen also in the last COP11 and under the word. Tibor, can you hear me, Tibor?
You're breaking up a little, Laurent. You might want to turn off your camera, but I think you're turning it over to Tibor.
Tibor, yeah, I'm going to turn my camera. Tibor, can you hear me? Yeah, go ahead. The floor is yours. You're muted. We cannot hear you.
Thank you. Thank you very much, Laurent. I hope you can hear me now. And I try to share my screen as well. And indeed, I will start with some intergovernmental approaches to the tobacco endgame. And when I was given the topic of this presentation, I had a lot to think about because, in fact, there are three concepts here: the Article 2.1 of the Convention, the intergovernmental nature of tobacco control, and the tobacco endgame. And I put them all on a paper, and I was trying to connect the dots between the three. And this is what I would like to talk to you about now. What is the connection between these 3 points? And before starting my presentation, I would like to clarify these concepts as we see it from the WHO-FCTC point of view. So when we think of intergovernmental approaches, of course, we know that the WHO-FCTC as an international treaty, as every international treaty, it is a result of an intergovernmental cooperation. And it is promoting intergovernmental cooperation and longer-term collaboration for the development of new ideas, and I will explain it how that takes place. So the WHO-FCTC in itself is a platform for intergovernmental cooperation and longer-term collaboration between those countries that have ratified the treaty, and we call them parties. Then the second platform is the Conference of the Parties, and I'll talk about it a bit later, because that's another platform where the parties to the convention meet, they discuss issues, and they come up with solutions and a way forward on particular areas related to the implementation of the convention. And the third point, which I would like to refer in relation to the FCTC, is the global strategy to accelerate tobacco control. 2019, it was originally 2025, now extended to 2030, is a global strategy, is in fact the only global strategy for tobacco control developed by the parties of the WHO-FCTC, which was written also in the spirit of intergovernmental cooperation and collaboration. Then there is the issue of tobacco endgame. And the tobacco endgame is not really used in the FCTC spheres, but we are using another term, which is called forward-looking tobacco control measures. And we anchor those measures under Article 2.1 of the Convention. So if we consider the tobacco endgame as the destination, then the forward-looking tobacco control measures are the routes, the tools, the avenues of reaching that tobacco endgame. And I remember that Ash organized the webinar on tobacco endgame already back in 2021, when the then head of Convention Secretariat, Dr. Adriana Blanco Marquizo, already called the tobacco endgame the destination, and she defined it as a situation when tobacco use prevalence is around or below 5%. And when all tobacco control measures are not only in place, but they are so efficiently in place, they are so impactful that the country itself has realized this final, let's say, destination, which is the tobacco endgame, to phase out almost completely tobacco use. So I use these three concepts: intergovernmental approaches, the tobacco endgame, or forward-looking tobacco control measures, and Article 2.1 of the Convention in my talk. So let's start with the WHO-FCTC. I'm sure you all know it's an international treaty. It's an evidence-based international public health treaty developed by governments. It's a result of intergovernmental collaboration, if you wish, and it reflects a holistic, intersectoral, whole of government approach. As Laurent has already mentioned, there is no one single government department which should be fully tasked with implementing every requirement of the convention, every obligation under the convention. Each and every government department has its role and responsibility in the implementation of the WHO-FCTC. And the FCTC provides an international platform for collaboration. Collaboration when we do something together to shape the way forward. For example, to develop a policy in line with the requirements of the WHO-FCTC, and COP is a governing body which is going to do that, and I'll explain that a little bit later. And cooperation, it's a platform for cooperation between the parties to the convention, aligning the goals, developing policies or measures with cross-border impact, for example, cross-border advertising or control of illicit trade in tobacco products. So WHO-FCTC is an intergovernmental platform in itself. And then let's narrow it down to Article 2 of the WHO-FCTC. Article 2 of the WHO-FCTC is called the relationship between this convention and other agreements and legal instruments. And in fact, I would even put aside a little bit this title, because there is another concept included here under Article 2, which is even more important from the point of view of this webinar today. And that's Article 2.1. And this says that in order to better protect human health, parties are encouraged to implement measures beyond those required by this convention and its protocols. And nothing in these instruments shall prevent a party from imposing stricter requirements that are consistent with their provisions and are in accordance with international law. So Article 2.1 allows the parties to think highly of what they can achieve, think beyond the basic requirements, because some people used to say the WHO-FCTC is the floor, not the ceiling. So Article 2.1 of the Convention allows the parties to think of the ceiling, where they could reach in terms of innovating in tobacco control and introducing measures that go beyond the requirements of the treaty. And Article 2 is today reflected in the WHO FCTC reporting instruments or reports submitted by the parties on their work in implementing the FCTC are available in the public domain. And you will see in these reports from 2023 that we are asking the parties whether they have implemented measures that go beyond the requirements of the treaty, while in 2025 we introduced a completely new segment, a section in the reporting instrument asking questions about Article 2.1. So Article 2.1 and the measures that could support the endgame are part of the convention, and they are anchored in Article 2.1 of the convention. Now, let me put this aside a bit and let me talk about the Conference of the Parties for a few moments. The Conference of the Parties is the governing body of the convention. It's the only international intergovernmental body fully dedicated to tobacco control. WHA of WHO might consider items that are related to tobacco control, but they consider items related to many different issues related to global health, while the Conference of the Parties is fully dedicated to tobacco control. And if you check Article 23 of the Convention, you will see a description of the roles and responsibilities of the Conference of the Parties. And one of them is to keep under regular review the implementation of the Convention and take the necessary decisions to promote the effective implementation of the treaty. And here we are. And let's go to see one of the most recent decisions of the Conference of the Parties that relates to the tobacco endgame, and which is called Forward-Looking Tobacco Control Measures reflected on the COP's agenda. So a little bit of history on the left-hand side. In 2024, the 10th session of the Conference of the Parties decided to establish an expert group on forward-looking tobacco control measures that could be contemplated within the scope of Article 2.1, and as I explained it already, that expand and intensify approaches to tobacco control. The expert group had about 1.5 years to develop its report to the Conference of the Parties, and they made a proposal in terms of in the form of a report, which they submitted to COP11 for consideration. And within that report, the expert group explained that during these past 1.5 years, they identified in the international literature around 40 measures which are evidence-based and which could be considered as forward-looking tobacco control measures. And of those, they selected, according to certain criteria, a short list of 16 tobacco control measures for detailed presentation to the Conference of the Parties. And on the right-hand side, you see the list of all 16 measures. And among the documents that the expert group submitted to the Conference of the Parties, you will find documents that explain these measures in a very detailed way, including what evidence is available for supporting those measures, how they work in everyday practice, what is in the impact of those measures, and how they could contribute to reaching the overall aim of the tobacco endgame. I will not read them out, but there are 16 in total, categorized in 4 categories: tobacco supply, institutional structure and market-related ones, product-related ones, and finally, there's one that is aimed at the consumer, and it refers to smoke-free environments. The COP, as an intergovernmental body, considered all these proposals by the expert group, and they took a decision in relation to these forward-looking measures. In fact, they adopted a COP-approved menu of endgame compatible policies. And they also established the next steps by inviting the parties to the convention and requesting the convention secretariat to carry out some work in relation to those forward-looking measures. So in this decision, and I will give you the link to all documents, including the decision at the end of my presentation, invites parties that in accordance with their national laws, regulations, contexts, and priorities, to note the list of forward-looking tobacco control measures, which they propose to all parties as voluntary measures. They are not included in the treaty per se. They were developed under the treaty, so they are proposing to parties to take them up on a voluntary basis and to consider them putting in place in their jurisdictions. But they also highlight that the list of forward-looking measures is not exhaustive, and other future forward-looking measures may be considered by the parties. As I explained, even the expert group have considered a long list of 40, and they created out of those a short list of 16. So if you look beyond these 16, you will find others that might qualify as forward-looking tobacco control measures, but for certain criteria, they have not found their way in the first 16. The Secretariat was also requested by the Conference of the Parties to disseminate the work of the expert group and the report which the expert group came up with. And this very forum is a very good platform for me to promote those forward-looking measures through facilitating experience sharing between the parties and the adoption and implementation of forward-looking tobacco control measures, publishing information received from the parties. So we publish reports, including the information which parties submit in relation to those measures which they feel belong to these four categories in forward-looking tobacco control measures. Support the parties and the work of the WHO-FCTC Knowledge Hub to develop and share best practices and case studies of the parties. And I would like to call on all of you who are listening to start documenting these measures and share the best practices within your networks. And finally, publish information materials, continue publishing information materials in relation to forward-looking tobacco control measures, including with support from colleagues from WHO. So let's look into the future a little bit, because now we have a list of forward-looking measures which was approved by the COP. But the decision is structured in a way to move these forward-looking measures, this menu of COP-approved measures, towards a cooperative implementation process. And I put some ideas in relation to how we could enhance international or intergovernmental cooperation to just ensure that more and more forward-looking measures are put in place by the parties. So one is within the frame of assistance we are providing to the parties. The COP decision opens the door for the promotion of these measures that could lead to or support the reaching of tobacco endgame. And tobacco control actors, including the knowledge hubs, including you all, including the civil society, including the parties, could offer to other fellow parties and to respond to parties' needs in putting in place these forward-looking measures by utilizing the same means as were proposed to the Convention Secretariat to share best practices, to document examples of implementation of these forward-looking measures, and so on. Promote international and intergovernmental cooperation as I said, better documentation and reporting of examples. What we could do, for example, we could share legislative models and regulatory templates in relation to forward-looking tobacco control measures. Implementation processes, how these forward-looking measures were actually put in place in a particular country, and what is the evidence of their impact. Awareness on good practices in mitigating the risks and the impact of legal challenges in relation to FLMs. We could even think of coordinated or parallel adoption of some of the measures in groups of parties or regional blocs. For example, synchronized retail or sales reduction efforts in neighboring countries, supply-side cooperation between the parties, especially in relation to production, import, export, market-related measures, and pricing, alternative livelihoods and environmental cooperation, enforcement and illicit trade control, integration in bilateral work. These are all intergovernmental approaches to putting in place the FLMs in particular countries or groups of countries. We could even think of involvement of international intergovernmental organizations, again intergovernmental, where the different governments are represented. There is the WHO, where the countries are represented. There are other UN entities where governments are represented. So why not asking help from those international intergovernmental organizations for putting in place the FLMs? And I'm just mentioning one of possibilities which the countries could do. They could request support by the UN country teams, for example, through the UN Sustainable Development Cooperation Frameworks, previously known as UNDAFs. So just a few examples on how intergovernmental approaches could be used to put in place FLMs in a particular country, FCTC party. Let me draw a few conclusions, but I leave it open for you to draw your conclusions and think further the aspects which I just brought to the table. So one of my conclusions is that as an international treaty with global reach, the WFCTC provides an unparalleled intergovernmental platform for advancing the tobacco endgame. As demonstrated at COP11, where parties were invited under Article 2.1 of the Convention to expand or intensify their tobacco control measures beyond their obligations. Don't forget, it's just the floor, not the ceiling, under the treaty, in order to better protect human health. But the bottom line is what Laurent has already mentioned, that every party should reach at least the stage of full implementation of the requirements of the WHO FCTC through a whole of government approach as soon as possible, preferably within the timeline provided in case of certain articles of the FCTC, and in line with the priorities given in the global strategy to accelerate tobacco control. Documentation and sharing of good implementation practices is critical in implementing FLMs through cross-fertilization and, if possible, in a coordinated way through cross-country cooperation. And for FLMs that are even more perceptible to tobacco industry opposition and interference, parties should facilitate, demand, or strengthen international and intergovernmental collaboration, which could help them to go beyond the requirements of the FCTC. And finally, this is a slide where you will get the presentation and you have the active links to different documents which I referred to in that presentation. And with that, I thank you for your attention. And Laurent, the floor is back to you. Thank you.
Thank you, Tibor. Thank you for reminding us that the FCTC and the COP our platform for cooperation and collaboration, even for around implementation of forward-looking measures between parties, and for reminding us also that the FCTC measures negotiated between 2000 and 2003 were really the floor and not the ceiling. So governments really to protect health really should go and move forward and implement those measures. And again, as we always say, it's not it's a recipe and not a menu, in the sense that those in combination that will help really achieve endgame goals. I will give the floor to the next speaker, Ben Carrick with Kenvue. That's a corporation that has come up with a very new and innovative nicotine-free future approach. And as far as I know, no other company has yet done that. But Ben, can you tell us a little bit about this project and how? Just go ahead. The floor is yours, Ben.
Thanks, Laurent. I'm just trying to share, but it looks as though what's sharing is the wrong screen. So I'm just trying to change.
You're on the right. You're on
Yeah,
your
we saw.
Oh, was it the right?
It was good. It was good. It was good. We could see you.
Okay. I will just share again then, just to make sure. So hopefully you can now see
It works. Yep.
the screen. And firstly, very quickly, a thank you to Laurent and the team at ASH for the opportunity to be able to speak to this audience today and represent the views of Kenvue and by extension, part of the private sector. Just for those who aren't aware, very briefly, we at Kenvue we're the largest global consumer healthcare company by revenue. We operate in multiple areas across skin health and beauty, across essential health, and pertinent to this discussion around self-care with particularly over-the-counter medicines. Now, our purpose is about realizing the extraordinary power of everyday care, and the part of our portfolio for everyday care that this links to is Nicorette and our interest here in tobacco control and smoking cessation. So with that in mind, where we are placed, our mission as Kenvue with Nicorette is to save the lives of smokers. It's a short mission in terms of that area, but we think it's a laudable and valuable one, and is aligned with the vision of many people on this call today. Our vision related to that mission is to see a world free from tobacco and nicotine, and I'll kind of come back to the and nicotine piece a little later. But I think one of the things that we understand and appreciate is that in order to kind of see that mission and vision come to life, that isn't something that we can deliver in isolation. This is something that's very much dependent upon across society and a multi-sector approach. If you like, this kind of change will only be driven by a village, which includes the engagement of policymakers, healthcare professionals, the public health community, civil society, and we are committed to playing our part as the private sector, who we think have a role to play here. Now, in terms of our role, we have a long established history in this space. So as well as over 50 years of research and development in this area and over 40 years in manufacturing and marketing smoking cessation products with Nicorette, we have also taken an active role over many years around advocating for tobacco control policy change, notably and unsurprisingly in the smoking cessation area. Now, from our perspective, we, and related specifically more to the tobacco NCAM discussion, we obviously fully applaud and recognise the massive achievements that have been made over the years in tobacco control, particularly the just over 20 years since the FCTC came into force, and alongside that, the Empower measures and the huge impact that those positive measures have had. But we also recognise that with around 1.3 billion people around the world still smoking, that there is more to do. And when we think about the impact of that number of smokers on things like the burden for non-communicable diseases, there's more work to be done whilst we applaud the success that has been had to date. And that's why we welcome the continuing debate and dialogue around future-looking measures, and why we have been happy to support some of the advocacy around tobacco endgame policies. For example, myself and my colleagues in the UK have been playing a role in advocating to support the activity underway now on the UK Tobacco and Vapes Bill, which includes, and I got to remember the language because I had, in my mind, I had different language, but I think in the last presentation we heard tobacco-free generation was the language used, but we've been happy to support that. But I think one of the things that from our perspective is critically important to consider is that in parallel to further implementation of the present and looking at the future measures that denormalise tobacco use, that we also need to ensure continued availability of evidence-based smoking cessation treatments and services to support those people around the world who smoke. So we think that is a critical thing to sit alongside of that. And I think one of the things that we would highlight is and I'm sure it's the same for many of you, are concerned about the changes we've seen in, I guess it's probably around the last 15 years. This is no longer a challenge of combustible tobacco versus cessation, but now we have a much broader category of products available around the world, which are giving people the opportunity to not just move away from smoking, but in many cases, it's driving an uptake of nicotine and alternative tobacco use, particularly by young people. So whilst we acknowledge that any step away from smoking is a positive step, and that for some smokers, some of the recently emerging alternative tobacco and nicotine products have a role to play in helping people who would otherwise not change their behaviour, we also believe strongly that it's important to try and help all of those people to complete a journey to complete cessation. And we don't support what we're starting to increasingly see around the uptake and recreational use of alternative tobacco and nicotine products by non-smokers, particularly by young people. So I guess what I'd like to just quickly reflect on is our response to that as Kenview, and what I hope shows that the private sector can and does demonstrate a valuable role alongside other partners in this space. Because we see our role beyond our manufacturing and marketing of smoking cessation products as being part of that collaborative group that is advocating alongside policymakers and the public health community to create a world free from tobacco and nicotine. So what does that look like for us? Well, we were one of the early or foundational members of the WHO Tobacco Cessation Consortium, which we welcomed because, a little like this discussion, the role of the private sector as one of the partners was welcomed. And under those auspices, what we have done is things like we secured the addition of nicotine replacement therapy lozenge and oral spray to the WHO list of essential medicines. What we also did was we worked with the pre-qualification team at the WHO to secure the pre-qualification of nicotine replacement therapy patch and gum based on our own regulatory acceptance of those areas. So really trying to look at ways to enhance access and availability of evidence-based treatments. We're pleased to say that we're a foundational member of ASH's Global Tobacco Endgame Council. And indeed, last year we also supported with the first Global Tobacco Endgame Summit that happened in Dublin the day before the World Conference last year. And I think the other thing that I kind of want to highlight here is, and I'll say a little bit more in a second, or I'll play a short video in a second, is we've also launched a campaign called Total Quit. And that's really around looking at the ways to move to a future free from tobacco and nicotine. So championing the cause of a life free from both tobacco and nicotine. And I think the other thing that I should say we're doing is, where regulation allows, we're also seeking to extend the use of our own nicotine replacement products beyond only smoking. So to date, in 3 countries, we are now licensed to support people who have moved to vaping and get away. But I think really what we want to emphasize here is our Total Quit campaign in terms of one of the ways of trying to work in partnership with others. So I am hoping this video will play. Can people hear?
No.
To achieve
Yeah,
a future free
it's
from
working.
tobacco and nicotine, we can't stop now. The battle against tobacco has been a major health success. The number of smokers has fallen sharply in recent decades. It's tempting to think the fight is over. It is not. Total quit is complete cessation of tobacco and nicotine. Quitting smoking is critical, but it is only the first step to complete that journey. Some new nicotine products and flavors have been exploited to hook new generations or keep tobacco users in a cycle of harmful addiction. An addiction which has a negative impact on both health and finances. What's more, these new nicotine products are becoming known for recreational use, making young people who might never have touched a cigarette before a target. They may perceive them as safe or even harmless. They are neither. In the face of this new challenge, we need a new policy agenda that can educate and prevent against the harms of these new forms of nicotine and reassess what quitting means. Our shared mission must be to create a future free of tobacco and nicotine, to ensure the current and next generations and the healthcare systems they inherit won't have to bear the burden of these addictions any longer. So today we're urging you, let's create a nicotine-free future. When freedom from tobacco and nicotine is in reach, total quit must be our aim, and a tobacco and nicotine-free future our destination. We can't stop now.
So we hope this campaign will be a rallying call to bring people together around this push and this drive towards a tobacco-free and a nicotine-free society. You won't get the video in the slides that come out afterwards because it makes the file too big, but you will get this slide which will give you access to the link to find that and more information on Total Quit. And with that, I will hand back to Laurent.
Thank you so much, Ben, and reminding us that for this Total Quit campaign, reminding us even addiction in and out of itself, even if the delivery mechanism was safe, addiction is still harmful. So, it's great to hear from this initiative. I'll go straight because we're a bit behind with time. I'll go straight to our next speaker, so Hanna Olilia, who's been leading a lot of the Endgame work within the European Commission Joint Action Task Force, and also doing a lot of work in Finland. So, Hanna, the floor is yours. And also, if you have any questions to any of the attendees, please use the Q&A. There's already a few questions, but please use that platform rather than sending them to me directly. Hanna, go ahead.
Hello. Thank you so much for inviting me to this very interesting webinar. I will be starting to share the screen at the same time. And apologies for the lighting here in this room. It's evening in Helsinki, so the lighting in this office is not the best best at this moment, but I hope it doesn't
Screen sharing now.
Yes, doesn't create any issues. Okay.
Okay.
So, as I said, again, thank you very much for the invitation. I will be then going more to the national level actions, advancing tobacco endgame on this level from the Finnish Institute for Health and Welfare, as I said, based in Helsinki. I don't have any competing interests. So in this presentation today, I will be talking briefly about the importance of advancing these national actions and information exchange, provide a few examples of the tobacco endgame goals and strategies from Europe, and also address some key considerations in tobacco endgame that we have derived from working with several national authorities from the different countries in Europe, and also just to highlight some of the upcoming work in a new project. To go to the importance of the national actions for many governments, the easiest and most obvious place to show the commitment to tobacco endgame is through different strategies and action plans. And these are really important as they provide the long-term vision and also sustainability to this work across the political cycles. When the government changes, the priorities easily change, but these long-term strategies or action plans, these official tobacco endgame goals are really important for this. These strategies and action plans also support the tobacco control work, implementation of the existing regulations, but also regular revisions of the key tobacco control provisions in the national legislation. They support cross-sectional coordination and collaboration, and importantly also advance the health in all policies aspects, and also create opportunities for the civil society engagement. And these strategies and action plans are also very good in facilitating the political commitment. Once you have been able to get the political commitment to actually have this kind of strategy, national tobacco endgame goal in place, these are also very useful to keep and sustain these commitments. But then at the same time, having these strategies and action plans also require a lot of political commitment to get these developed in the first place. But just having these strategies and action plans, national level goals is of course something that should not just be left there, but we should really exchange information of these between the countries and between the different governments. As this really facilitates the dissemination of good practices and enhances cross-country collaboration. And I will go into this a bit through presenting some of the work that we have been doing with other European countries in these joint actions. Many of you are probably not aware and not familiar with what this kind of joint action is. So this is a specific funding mechanism under the EU funding, the EU health program, and this is specifically tasked to promote collaboration between the EU member states and the Commission to address some of the key EU health policy priorities, and sharing and piloting, for example, different tools and approaches. And importantly, to be implemented by a consortium of national public health authorities. So these are really projects and funding instruments to really support the collaboration between governments, and then also share information that the governments can use as sort of a peer learning to advance, for example, in this question, the tobacco endgame goals or the forward-looking measures. In this previous joint action, which just ended 2 years ago now, joint action on tobacco control 2, we were working directly with tobacco endgame in a group of 16 countries. And we did a lot of different assessments and data collection work. I won't have the time to go in detail to this, but I just decided to show here some of the examples that we gathered during that work. When we were assessing the status of these national goals that are specific to tobacco endgame, we already see here that actually quite many European countries have these kind of strategies, these official goals in place at the moment. So these are the countries which are marked with the blue color on the map. There's a lot of variation, both for the timelines and for the included products, but quite many countries do have the less than 5% level selected as their definition of these endgame goals. There's also variation in terms of the covered products. As I said, there are already 2 countries which include nicotine also in their tobacco endgame official goals. These are Slovenia and Finland. And there are also some countries which already have had their timeline passed. So Ireland and Sweden, they already had the 2025. So it's now very interesting to see what are the next steps in these countries, whether they are revising their strategies, and if they are doing so, how are they going to approach it. For example, as quite many of you probably know, Sweden has been very focused on just smoking prevalence, and there's a lot of industry narratives around this. So it's a very interesting case also to see if they are going to expand it or develop it in any ways. From Ireland, I've heard that they would be in the process of revising and developing a new strategy. So there's many things to wait from these countries in the next years. From this assessment, we also saw that in some countries, while there were not yet these national official goals, there were some relevant proposals, for instance, from the scientific societies. So these countries are shown with the orange color in this map. Besides these national strategies or goals that were shown on the previous slides, in Europe there is also a strong regional goal. This was launched in 2021 as part of the EU's cancer plan, and there is this concept of tobacco-free generation, which is different from the generational sales ban concept, which many of you are familiar with, but it's defined as the more general tobacco endgame goal or target as the less than 5% of tobacco use in Europe by 2040. And recently, in the end of last year, the Commission also launched a new cardiovascular health plan, which is called the Safe Hearts Plan. And the good news was that this previous goal was confirmed there. So this strategy also states that the long-term goal is for fewer than 5% of adults to be using tobacco by 2040. So through this regional goal, there is a lot of support for the governments in this region to advance tobacco endgame or the forward-looking measures on the national level. But this also really requires national actions, as many countries in this region still have a very high tobacco use prevalence, so much needs to be done in order to reach also this regional goal. We, from this work with the 16 countries from the region, also derived some key considerations that are useful when working with these national tobacco endgame goals and strategies. And this also goes back to what was already said in the first presentation here today, that actually these national strategies and forward-looking tobacco control measures are complementary. So while some countries have successfully worked with these national strategies, have been able to adopt these, in some countries it just might not be feasible at all. And for these countries, these forward-looking tobacco control measures, these individual policies might be a much more feasible option, but still aiming for the same end result. So fitting these to the national context when developing the strategies or measures is really important. And also then remembering this, which was also discussed earlier on, these best buys, such as the taxation, really connecting this also to the tobacco endgame work when these measures and goals are being developed. Some other key considerations were that it's really important to focus on the products and supply. And it's for this, it's also very, very important to avoid the stigmatization of those who use tobacco, given the dependence coming from nicotine. And this also links to the previous presentation on the effective cessation support. So this really needs to be also integrated to this national strategy work. And when we were reviewing the strategies in Europe, we saw that there were many references to providing cessation support, but in practice, this is still something that many countries in this region really need to develop. For the forward-looking tobacco control measures or any other measures that are connected to the tobacco endgame, there needs to be prioritization. So using the available evidence, using the information from the neighboring countries, for example, selecting the measures which are expected to produce substantial impact in the specific tobacco control context. And of course, resisting industry interference is extremely important on national level within governments, really adhering to Article 5.3 of the FCTC and scrutinizing these industry-driven harm reduction initiatives. Many authority representatives in our group were really thinking that this is something that has unfortunately created a lot of distraction also among policymakers, among regulators. So really scrutinizing these narratives is something that we need when advancing the national level goals and measures. And regardless of this approach being with the national goals or with some individual policies or measures, it is also really important to remember that also in the FCTC there is this requirement for all parties to prevent not only tobacco consumption and exposure to tobacco smoke, but nicotine addiction is also very clearly mentioned there. I don't have time today to go to this, so I just show, if you are interested in learning more about this work, we developed this Tobacco Endgame Toolkit .eu, so you have also our publications and policy briefs and a lot of information also from the European countries available there. But before closing, I also wanted to say a couple of words about the upcoming work in this new joint action, where we really focus on the forward-looking tobacco control measures. And this will build a nice continuity to the expert group report, which Tibor presented in the first presentation. So this joint action called JA Safe is about health promotion and smoke and aerosol-free environments. And in this project, we have 2 tasks that are specific to the forward-looking tobacco control measures. And in these tasks, we will be working with several European countries, sharing, again, experiences and information to conduct feasibility assessments for these measures in 5 European countries. And this will be sort of a real-life check for the list of the 16 measures that Tibor presented in his presentation. So this will be very interesting work ahead. Also regarding the evidence base, a lot of the modeling studies and the evidence related to this forward-looking tobacco control measures comes from outside Europe. And we will be also addressing this gap and developing a modeling study specific to the European context. And this work will then lead also to EU-specific publications and actions. Yes, I think that was all for that today. Very happy to talk more about this later on. And if you're interested in learning more of these joint actions or hearing more about the GA Safe specifically, then please feel free to contact me. I am the person who's leading these tasks, so very happy to connect with all interested ones. Thank you very much.
Thank you, Hannah. And I think if it's okay with the other panelists, we'll stay a little longer so we have time to address some of the many questions that have come up. And thank you for bringing up the importance of having a national strategy. We're concerned about some cases where they go on with one-off policy without having a strategy, which we've seen a few cases of that. But and reminding us also important to address the supply side of those nicotine products, and then also the link to the need for cessation. As we implement those policies, we need to make sure that if governments allow for the sale of nicotine products, they have to help people become free from those products also. So we will go straight to the questions. And thank you to the panelists for staying a little longer. We lost, unfortunately, some of the audience at the hour because probably they have other commitments, but go straight to the questions. And so the first question is whether there's one that has had more of a negative response or strongest resistance from the tobacco industry. In general, we know that all policies the tobacco industry litigates, stops. It could be anything from tobacco taxes to any of them. But do you have any awareness of any specific policies that have really created anxiety for the tobacco industry? I mean, we know TFG was defended in Massachusetts with the Massachusetts Supreme Court in this case. But are you aware of other measures that are really? I'm assuming they all are going to create problems for the industry.
I can start, and then the other panelists can join me. Of course, if we think back to the FCTC, there was the plain packaging, advertising bans, price and tax measures, which did not pass the scream test of the tobacco industry, but more recently the product regulation related interventions. And I remember that before COP11. At least in Europe, where the COP actually has taken place, exactly these product-related interventions resulted in the strongest coverage in the media, and of course, that strong coverage in the media was very likely fueled by the tobacco industry. So I remember that flavor bans, retail reduction, tobacco generation bans, those were high on the media before the COP. But Hannah, if you remember of others, just please add.
Hannah, do you want to add
Thanks.
anything?
Yeah, I think I can add some. Well, I would say that, for instance, in the European context, for example, the measures related to filters. So I think that's something where the industry is very, very active, very opposing, and I think that's one key message, the scream test that you mentioned, Tibor. So this would definitely be one of those, as it really taps into the product standards, and then also to these people's images. People still think that the filters are somehow making these products safer on. So it will sort of start kind of a snowball effect, which the industry is really, really afraid of.
Yeah, and this ties to one of the comments or questions that was made by Dr. Thomas Novotny on the upcoming EU plastic directive, COP11, and some of the recommendations in the Article 18, the environmental article in the FCTC that were submitted to the last COP, also proposed addressing the upstream's measures to address the environmental impact of tobacco. So they were also addressing that as a potential measure. There's quite a few questions, and there's one that it's important. I wanted to go quite right away. And I would like to hear from the three of you on that. When setting national goals, how can countries account for subpopulation variation so that health disparities are not ignored? And I know New Zealand did that. So, for example, in New Zealand, when they did their modeling, to achieve a 5% or below smoking prevalence for the Maori population, they felt that tobacco control, as usual, was going to take 30 years to achieve those targets. With the denicotinization and retail licenses, elimination of retail licenses, they could achieve it in a fairly short period of time for the entire population, including Maori population. But how do you do that, Hannah, in countries where you could have disparities and you could easily achieve maybe 5% or below for some populations, but then not for others?
Yeah, that's a very important point, and what we found when we were assessing these strategies in the European countries that were participating to the project was that actually many countries were referencing these population group differences in their strategies, but they didn't yet really have the measures tailored to actually do something about these differences. And also many of these national goals, they are for the general population. So having any kind of subpopulation goals was really rare, almost existing. So this is something that the countries really need to also develop. when they are, for instance, revising their national strategies, or for those countries which yet don't have these tobacco endgame strategies. This would be really important to then include in these new strategies.
Because the goal is the same for the entire population, but the measures do not have impact there. So I remember, for example, in Northern Australia, when taxes, for example, really decreased prevalence among general population, but Northern Aboriginal populations, for example, we continue to smoke at higher rates. So
yeah, but it's really important to really have this included in the situation analysis when you start to consider any new forward-looking measures. For instance, what's the situation in the different population groups? What are the expected impacts? Can there be some unintended consequences as well? So having these structured assessments before going to the adoption and implementation is just really important.
So including that in the impact assessment also at the onset to ensure that various populations are included. Ben, Tibor, do you have anything to add on that?
I have one point maybe to add. I don't want to repeat what Hannah said. Measuring and addressing is very important. But there's one article, Article 5, with the national coordinating mechanisms for tobacco control. It's very important that representation of these populations, which know the populations best, including the results or measurements of prevalence, they are represented in these bodies, so that when a national tobacco control strategy plan or program is put together, then the representation is there and they have their voice, and they require the specific interventions that are necessary. So I think in terms of general obligations, it is very important that the representation is all-encompassing, including these population groups.
We're getting really close up. One last question. So there was questions of the focus on tobacco and nicotine-free future. And Tim McAfee is asking Stefan whether this can happen without a world free from commercial for-profit tobacco and nicotine companies that exploit basically the addiction as part of their business model. And so you mentioned it's nice to see an industry working on cessation, but not on commercializing nicotine. But just do you want to comment on that? And obviously we would want to all of the entire private sector would benefit from a healthier population that's free from nicotine addiction. But any questions on this? And it's fairly.
So I guess the way we look at it, Laurent, is, I mean, we're a smoking cessation and company. So for us, the aim is to use licensed smoking cessation nicotine-containing products like Nicorette for as short a time as is necessary to help people quit smoking, and then our aim is that they come off our products. We don't want to see unnecessary long-term use or recreational use of our products. I guess there is another part of industry that has a slightly different agenda. I would probably be cautious about it becoming a debate on two sides of the private sector about the rights and wrongs directly, because that gives people who don't have the same view as us the opportunity to point at things and say this is about different commercial agendas, and they can use that to get in the way of a much more legitimate public health debate. I think what I can say is we will continue to make the case in our advocacy around tobacco and smoking cessation policy around the world that we believe smokers should have access to evidence-based cessation treatment and services. And from our perspective, once they have quit, then we want to see them getting off those products like ours and living a life free from tobacco and nicotine. So probably isn't best to get into a two sides of commercial debate only from one company to another.
So I'm going to give you the opportunity, the three of you, to say the last words. But I want you to add maybe in your last words, address this question. Why wait until year 2030? Why not this year or tomorrow? I think it's an interesting question, because one thing that has emerged when we discussed Endgame, or it's the discussion has shifted from is this feasible to how fast can we get there? At least within the public health community, it's a real change. So I'll let you address final words, but what can we do to accelerate this progress towards the endgame future, a nicotine-free future? Hannah, do you want to go first, then Ben, then Tibor?
Yeah, sure. I think in order to make this movement faster or really advance these measures, it's just so important to share the information of these measures and of these strategies. For instance, when we have been working with a group of countries in these joint actions, it's been so good to be able to ask like really practical questions and really help each other in identifying the relevant and feasible next steps. So I would really hope to see that this happens much more, and there are many more platforms where countries can really share this practical information, which is also needed in order to find the working solutions.
So I guess on the question of should we be more aggressive than 2030, I think firstly, targets need to be set because it's that old maximum. If you don't measure it, they don't happen. So something needs to be put in place. But I think I reflect on things that Tibor said earlier when he was speaking about Article 2. Many of these things are about they're setting a floor, not a ceiling. So I think if 2030 is a reasonable target to kind of give people focus, that shouldn't mean that we don't seek to get there sooner. It should be a no later than, and use 2030 perhaps as the floor, not the ceiling.
Tibor? Oh, you muted.
Sorry, it's very important that most of the FCTC parties achieve at least the floor as quickly as possible and then go beyond. But unfortunately, there are still many countries that have not achieved that floor. So assistance is urgently needed, and I think we need to scale up the assistance to these parties to bring them up and help them join those that at least put in place the minimum requirements of the convention and then quickly go beyond. Of course, those that are ready to go beyond, they should have the information, as Hannah said, and it is important to help them with information, with best practices, with legislative templates and so on, to go beyond what they have already achieved. Thank you.
Well, thank you. I want to again. I want to thank you, the three panelists, for joining us today for those great presentations. Obviously, quite a lot of interest, and people are willing to stay past the hour to be able to allow you to answer some other questions. So thank you, and thank you also to everyone who joined us today, and continue this great work to make the world a healthier place. So thank you so much, and keep in touch.